Every day I meet men who believe everything is normal until small signs start creeping in. The urine stream weakens, the urgency becomes harder to ignore, and the nighttime trips to the bathroom turn into a frustrating routine. It often feels like these changes came out of nowhere, but the truth is that what you eat daily may be quietly feeding the problem. Many men do not realize that common foods can increase inflammation and irritate the bladder. These reactions may worsen symptoms tied to an enlarged prostate. What seems harmless on the plate can trigger more pressure, reduced flow, and constant discomfort. This connection often goes unnoticed for years. In this video, I will reveal 5 everyday foods that may look innocent but can influence urinary symptoms directly. I will also explain what current scientific evidence actually shows. My goal is to give you clarity so you can make smarter choices without confusion. Your prostate health depends on understanding these hidden triggers. I am Dr. Isabel López, specialist in men's health. Tell me in the comments where you are watching from and share your city. And make sure to follow this channel so you never miss essential updates for your health. Now, let us move deeper into why food matters more than most men think. Before discussing the specific foods, it is important to understand why diet plays such a powerful role in prostate health. The prostate responds strongly to chronic inflammation, insulin resistance, and changes in hormones such as DHT. These processes are heavily shaped by what you eat daily. A diet that encourages inflammation can disrupt weight, metabolism, and hormone balance. When these systems shift, the prostate becomes more reactive and symptoms intensify. This is why small dietary habits can have large long-term effects. Every meal influences your internal environment. It is not about one single villain. It is about a pattern of foods that consistently overload your body with inflammatory signals. When that happens, the urinary system becomes more sensitive and symptoms become harder to control. Many men discover this connection only after years of discomfort. Now that you understand the foundation, let us take a closer look at the first food group that contributes to this inflammatory cycle and worsens symptoms more than most expect. The first food on this list is processed meats such as bacon, sausage, and deli ham. These products are loaded with sodium, nitrates, and preservatives that promote systemic inflammation. When consumed regularly, they push your body toward a more reactive state that can heighten prostate irritation. Studies consistently show that frequent intake of processed meats is linked to metabolic problems. These conditions, including insulin resistance, are known to accelerate the progression of prostate enlargement. Stick with me until the end, because the next foods might surprise you just as much. For men already experiencing weak flow, urgency, or nighttime urination, these meats can intensify symptoms. The additional salt content causes more fluid shifts, making the bladder even more sensitive. This combination creates a perfect storm of discomfort. A practical adjustment is to reduce processed meats and replace them with fresh options such as fish, chicken, or eggs. Now, let us explore another common food group that may be affecting your prostate without you realizing it. The second food category is full-fat dairy consumed in excess. High levels of saturated fat can increase inflammation and stimulate hormonal pathways linked to prostate growth. This makes certain dairy products more problematic when eaten in large amounts. In some men, full-fat dairy can also irritate the bladder, increasing urgency and discomfort. This sensitivity varies from person to person, but the pattern is common enough to deserve attention. Listening to your body is key. Choosing lighter options such as low-fat milk or reducing overall dairy intake can make a noticeable difference. Many men report improved urinary comfort within weeks. Simple adjustments can lead to significant changes in your daily routine. With that in mind, let us move to the third food on this list, one that affects nearly every system in the body and has a powerful impact on prostate symptoms. Before we dive in, I want to share something special with you. I have created a 21-day challenge designed to help reduce and prevent prostate enlargement with simple exercises you can do in less than 15 minutes a day. Do not wait. Grab your copy of the ebook right now. The link is pinned at the very top of the comments. The third item is sugar and sweetened processed foods. These products cause sharp spikes in blood glucose, which then increase insulin levels. Insulin resistance has a direct connection to prostate enlargement and worsening urinary symptoms. Sugar also contributes to weight gain, especially around the abdomen. This type of fat encourages inflammation and hormonal imbalance, both of which place additional pressure on the prostate. Many men underestimate how quickly these foods accumulate. Reducing daily desserts, avoiding sweetened beverages, and replacing them with fruits is a powerful first step. Now, let us examine another common habit that becomes even more harmful when consumed at night. Alcohol, especially when consumed in the evening, is the fourth item on our list. It irritates the bladder, increases urination frequency, and contributes to dehydration. For men dealing with nighttime trips to the bathroom, this combination makes symptoms significantly worse. Alcohol also disrupts hormonal balance and contributes to chronic inflammation. These effects accumulate over time and may intensify prostate discomfort. Even small amounts at night can make a noticeable difference in how often you wake up. Limiting alcohol or avoiding it completely during the evening is a simple and practical strategy. Many men report immediate changes in nighttime urgency. It is one of the easiest adjustments with the fastest results. But there is still one more food on our list, and it affects men differently depending on sensitivity. Let us take a closer look. Join the members club, drop a super like, and let us finish strong with the fifth food on this list. Spicy foods, especially those with high amounts of chili and strong condiments, can irritate the bladder lining. This irritation increases urgency, burning sensations, and the feeling of incomplete emptying. While spicy foods do not enlarge the prostate directly, they amplify the symptoms many men already struggle with. The compound capsaicin is often the main trigger. For some, even moderate amounts can create noticeable discomfort. Managing spicy foods does not always require full elimination. Reducing frequency or adjusting intensity can help you understand